The 20-year-old Indian prophet Abhijit Anand is a person who previously accurately predicted the COVID-19 pandemic. His prophecies about the year 2026 have attracted significant attention. Anand shocked the public when he forecast an economic catastrophe in 2026. According to the prophet, gold prices could increase fourfold, equivalent to approximately $13,027 per tael. According to experts, such a fourfold increase would imply an extreme crisis such as a global war, the collapse of the monetary system, or hyperinflation. Abhijit Anand has been mentioned by several local media outlets as a prodigy prophet. Thanks to accurately predicting certain future events, he has astonished many people. In August 2019, in a video uploaded to his personal channel based on astrological research, Anand issued a warning about a serious global danger that would occur from November 2019 to April 2020. When Anand first appeared on the video sharing platform, his channel had very few views and comments. Most viewers at the time believed Anand's assessment was groundless and delusional. However, by November 2019, the COVID-19 outbreak erupted in Wuhan, China, and then spread to nearly all countries and territories worldwide. By May 2020, the World Health Organization, WHO, declared it a global pandemic. Immediately, the video predicting COVID-19 went viral across social media throughout India, South America, and many other regions of the world. As a serious global danger had indeed struck as warned, Anand was subsequently hailed as the youngest prophet in the world. Ladies and gentlemen, according to the website Bloomberg.com, in the history of the silver market, the price of this metal had only traded above $40 per ounce during a few brief periods prior to 2025. On the 31st, traders were shocked to witness this precious metal plunge within less than 20 hours. Over recent weeks, traders across the metals market have been staying up all night, glued to their screens, as prices from gold to copper and tin appeared to break free from fundamental supply-demand forces driven higher by a surge of hot money from Chinese speculators. Then, within just a few hours, the rally reversed into one of the most dramatic price crashes ever recorded in the commodities market. Silver plunged 26% on the 30th, the largest drop on record, while gold fell 9%, marking its worst day in over a decade. Copper traders, already stunned after prices unexpectedly surged past $14,500 per ton, then collapsed at a similar pace. The decline in precious metals extended into the early Asian trading session of the new week before partially narrowing losses amid extreme volatility. Spot gold at one point fell as much as 4%, while silver dropped 12% before reversing and rebounding. Dominic Schneider, head of trading at Harrius Precious Metals, said, "In my career, this is certainly the most chaotic situation I've ever witnessed." Gold is supposed to be a symbol of stability, but volatility like this is not stability. Although the catalyst for the crash on the 30th was news that President Donald Trump, intended to nominate Kevin Warsh as chairman of the Federal Reserve, which strengthened the U dollar. Many had already warned that the metals market was excessively stretched and in need of a correction after weeks of relentless gains. However, the speed and scale of this decline still shocked investors, particularly in a large and highly liquid market such as gold. Metals traders in Europe and the United States worked around the clock, unwilling to miss the Asian trading session where the most violent movements occurred. At the world's largest coin conference held in Germany last week, business leaders stood frozen, staring at their phones as the crisis unfolded. The rally in gold had been forming over many years as central banks expanded their holdings as an alternative to the U dollar. This trend accelerated in 2025 when Western investors rushed into trades hedging against currency debasement. However, in recent weeks, the rally intensified further, driven by a wave of purchases from Chinese speculators. From retail investors to large equity funds branching into commodities, they pushed prices of metals from copper to silver to new records. As prices soared, trend-following commodity trading advisors also piled in, amplifying the move amid concerns about the independence of the Fed and geopolitical crises from Venezuela to Iran dominating the media. The surge in metals prices reflected a growing loss of confidence among some investors in the U.dollar. The most violent price movements occurred in silver, a relatively small market with annual supply valued at approximately $98 billion at current prices, compared to $787 billion for gold. With an excessive number of call options outstanding, the market became prone to squeezes. Market makers were forced to rush into hedging by buying the underlying asset whenever prices began to rise, further accelerating the surge. President Trump's recent remark that the U.dollar was under pressure but still functioning very well triggered another wave of metal buying, pushing prices to new records. By the 29th, gold reached $5,595 per ounce. Silver exceeded $121, and copper touched 14,527 $50. The first sign of reversal appeared late on the 29th when the U.dollar strengthened as markets opened and gold suddenly plunged by more than $200 per ounce within roughly 10 minutes. Prices temporarily stabilized, but then Bloomberg and other news agencies reported that President Trump intended to nominate Warsh as the next Fed chairman. Meanwhile, future developments may once again depend on China. Investors will closely watch the opening of the Shanghai market to see whether Chinese demand for metals can recover after the shocking sell-off. Daily price fluctuation limits of 16% to 19% apply to many silver contracts on Chinese exchanges, meaning prices in Shanghai may take time to catch up. Nevertheless, the pre-Lunar New Year correction could provide an opportunity for market entry as retail investors who missed the rally are waiting to place trades. Amid lingering retail interest, several Chinese banks have announced new measures to curb risks associated with gold accumulation products for individual clients, following similar actions over the past year. Nipah virus, a deadly disease with a mortality rate of up to 80%, no vaccine available. Asia remains on high alert as airports tighten controls and new cases emerge. An emergency measure has been announced. Japan is preparing to conduct clinical trials of a Nipah virus vaccine, marking the first step in efforts to prevent a global health threat. The Nipah virus vaccine is set to begin clinical trials in humans. On the 31st, the TASS news agency, citing Nikkei, reported that the Advanced Science and Technology Research Center of the University of Tokyo will launch early phase clinical trials of a Nipah virus vaccine in April this year in Belgium. The vaccine is developed using a measles virus platform. When injected into the body, the vaccine stimulates the production of proteins similar to those of the Nipah virus, thereby enhancing the immune system and potentially preventing the progression of infection if exposure occurs. The University of Tokyo has confirmed the vaccine's effectiveness and safety through tests on hamsters and other animals. If the early phase human trials are successful, subsequent trials involving adults and children will take place in Bangladesh in the second half of 2027 to evaluate safety and efficacy. The Nipah virus can be transmitted from animals to humans primarily through fruit bats. It causes severe encephalitis and respiratory infections, with mortality rates in some cases reaching 80%. There is currently no preventive vaccine. Since its discovery in 1998, approximately 1,000 cases have been reported. Outbreaks occur annually in South and Southeast Asia, resulting in many deaths. 2 Nipah virus cases were recorded in January in West Bengal, India. Both patients are alive and receiving hospital treatment. The World Health Organization, WHO, confirmed that among the 190 individuals who had contact with the patients, none showed symptoms and all tested negative. WHO assessed the risk of national, regional, and global spread as low. According to Reuters, countries such as Malaysia, Thailand, Indonesia, and Pakistan have implemented temperature screening measures at airports to prevent potential Nipah virus transmission. Amid complex global developments, alongside vaccine research efforts, Vietnam is also strengthening preventive measures to prevent the disease from entering the country. On the 31st, the People's Committee of Da Nang City announced that due to the risk of Nipah virus outbreaks in several countries, Vice Chairwoman Win Thi An Thi signed an urgent directive requiring departments and local authorities to implement comprehensive surveillance and prevention measures to proactively block the virus from entering and spreading within the city. The vice chairwoman assigned the Department of Health as the core coordinating agency to enhance surveillance at border gates, medical facilities, and communities. Suspected cases must be detected early, isolated, and handled thoroughly from the first case, particularly during the Lunar New Year and festival season. Hospitals must strictly enforce infection control, ensure adequate protective equipment for medical staff, conduct training, and prepare personnel, supplies, medicines, chemicals, and equipment for outbreak response. Communication efforts are also required to help the public understand the situation correctly, avoid panic, and proactively prevent disease. The Department of Culture, Sports, and Tourism was instructed to coordinate with the health sector to strengthen communication at accommodation facilities and tourist sites, guiding visitors to implement preventive measures, especially those arriving from affected areas. The Department of Education and Training was directed to raise awareness among teachers and students and coordinate health monitoring and early detection of suspected cases. Relevant agencies were instructed to closely monitor domestic and international developments and coordinate intersectoral responses. The Vietnam Fatherland Front Committee of Da Nang City and mass organizations were tasked with mobilizing members and citizens to follow health recommendations and integrate disease prevention into community movements. Additionally, local authorities were instructed to enhance community surveillance, especially for individuals returning from countries with ongoing outbreaks such as India and nearby regions. People are advised to limit travel to outbreak areas, monitor health for 14 days after return, and immediately contact medical facilities if symptoms such as headache, muscle pain, vomiting, dizziness, confusion, or seizures occur. Food hygiene measures were emphasized, including avoiding contact with fruit bats and animals at risk of transmission, using masks and gloves when caring for suspected patients, and ensuring food safety. Vietnam has not recorded any cases so far, but epidemiologically, surveillance is required due to potential virus circulation among animal populations, particularly bats and possibly pigs as intermediate hosts. Associate Professor Dr. Trandak Phu stated that since Nipah virus is transmitted from animals to humans, surveillance must be conducted simultaneously in both humans and animals. Preventive measures should be applied based on epidemiological indicators. He emphasized that while vigilance is necessary, there is no need for excessive alarm. Chu Quoc Thin, acting director of the Department of Food Safety under the Ministry of Health, warned of infection risks through contaminated food and urged strict food hygiene practices, including avoiding wild animal products, fruit contaminated by bats, and food showing signs of being bitten or partially eaten by animals. WHO also released its latest assessment, stating that the threat posed by Nipah virus at national, regional, and global levels remains low. WHO is awaiting India's publication of the virus's genetic sequence to analyze potential mutations, but currently no concerning evidence has emerged. The Nipah virus is classified by WHO as one of the most dangerous pathogens, with mortality rates up to 75%. The disease begins with flu-like symptoms and rapidly progresses to encephalitis, coma within 24 to 48 hours, leaving permanent neurological damage in about 20% of survivors. There is currently no vaccine or specific treatment. Care is primarily supportive. Experts recommend avoiding contact with sick pigs, refraining from consuming raw date palm sap, and thoroughly washing and peeling fruit before consumption.